used. Okay, I got it. You're recording me. And then, I brought up the idea of conducting a sensitivity analysis to understand what's driving the scores. And I did get a response on that. And I haven't had time to really assimilate that. So I'm not really going to talk about the response on that. But we identified some data gap areas, which is essentially some of the data that's not collected, some of the data that we have to pay for, proprietary data, and some data that's just not accessible, that doesn't show up on Google search when you're looking, and data that's hard to work with, and data that you have to formally request. And then the other issue of that has to do with how accurate is the data, and then considering ways to best present all that data. So we covered a lot of topics. So is there anything that I didn't cover in the summary that we had discussed? Okay. Well, thank you. Thank you for being a part of that conversation. So I wanted to kick off this meeting by just revisiting our objectives to make sure that we stay on track and make sure that the work we're doing fits within those objectives. And so I'm just going to read through the subcommittee objectives, and then we can follow it with a brief discussion with anybody who has any input or anything they want to add on to that. That would be great. Or just kind of talk about what that specific objective means to you, and just throwing ideas out there on what you think we could be doing, or how we could be doing it differently, or how we could be doing it better. Because I think we're getting to the point where we may start thinking about drafting some kind of recommendation. So to answer the question that was raised in the chat, I think it has to do, are we accessing data from the Colorado? I don't know, I can't really see the whole, can you read it out for me, Labna? I can't see it on my screen.
Yeah, the question was from Juan Madrid with Green Latinos, and he asked if, he was curious if we are accessing data that's available from the Colorado Health Institute.
I'll add that to our list of a data source. And so I think, Juan, you'll get a better idea of how we are approaching this. As we continue to have this conversation today, and you see the agenda, will be talk a little bit about a framework that I've put together that will help guide this conversation. So I appreciate your question. I was not aware of that data set, and it'll definitely make our list of data sets that we potentially could recommend the state to look at. So the first objective of this subcommittee is essentially to address the lack of data and data sharing between state agencies about potential exposures to environmental hazards. So there's this feeling that I think this spun out of the whole conversation of an environmental justice community at a community meeting, having a conversation about potentially health effects that potentially could be occurring in their community, and then being told you need to show us data, and them not knowing what data that they need to show, or where this data is, or how accessible that data is to them. And then the question that state agencies all have their different data sets, and understanding who has what data set and how can we make them collaborate a little bit better around those data sets. Does anybody want to add any thoughts on that? My perception on that question. I don't know, I saw Beatrice flash on, but maybe she's just getting sat at her desk or something. Okay, the second recommendation is, I think, also key. It kind of dovetails on the idea of, if this data is lacking, so what kind of research efforts can we do to improve the data sets? What kind of actions can we do to improve how the data is collected, specifically how it relates to health and the environment of DIC community, for disproportionately impacted communities. So I think that's my understanding of the second one. So once we identify, the lack of data and start thinking about the issues or the challenges associated with data sharing, then we can start thinking about, how can we start thinking about ways to improve those two challenges. So, and then the third objective, I think, which is going to be the one that's going to be most time consuming from my technical side of this, is what kind of recommendations can we make to establish these measurable goals to eliminate these disparities for the disproportionately impacted communities. So that's going to be, I think we're going to have to roll up our sleeves and put a lot of thinking caps trying to work our way through that one. But my sense is these three questions kind of play into each other. So I think as we're able to, kind of get our arms around the first one, it will help feed into the second one, that will help feed into the third one. So any other comments on our objectives? I just wanted to make sure that we ground ourselves in this as we continue this conversation.
Thank you, Uni. I really appreciate it. Something that I would really love to see is sometimes as communities, they're hyper-focused on a certain issue that seems the most apparent, which might be, for example, sources of air pollution, right? But we don't see the bigger picture that also pollutes our water, it pollutes the land, or there's multi sources of pollution, and we're hyper-focusing on one source. And I think if making it easier to access data, but then also making it easier to understand the multiple sources of potential health hazards can be really important. And then I'm also wondering if there can also be a connection to potential health outcomes, so people can also easily understand and help connect the dots of how that it's not just information, but it manifests in our health, it manifests and maybe some people might have a better relationship with their own body and say, I can connect this to the external factors around me, and then I can better understand traffic, a point source of pollution, water, land, and again, the easier we can help people understand the cumulative impact and connect the dots, I think that is part of like equity and understanding the data as well, and making it all easier to be in one place. But thank you, Uni. You're doing a great job too. I appreciate your leadership.
Why, thank you. So I think what you're getting at is the whole concept of risk communication, is how do we talk about risk? How do we explain risk? All the facets of risk, starting with the hazard piece, identifying the various hazards in the community, and then talking about exposures, whether exposures are there or exposures are not there, whether exposures are cumulative or not cumulative, and how they tie all together to result in a risk, and what that risk looks like. So it's working through. So I guess tying it to the data piece again, it's part of that data question. Even if you have all the data in front of you, what does it really mean? I think that's what you're getting at. How do you tie it all together? So I just made a note down of risk communication because that's another place that I do work in. And I must have said the word okay because my phone is trying to talk to me now. That's weird. Okay, so yeah, that's a good point. That's a good point to make. And I think I'll add it to some of the things that we need to add onto our recommendation. So, and I'll keep talking about our recommendation because, like I said, we really need to think about how we're going to format it and how we're going to draft it, as we continue these conversations. So along those lines, oh, before I move on, is anything else anybody wants to talk about in terms of the objectives? Okay. As we move along, I mean, I had on the agenda, I'm not sure how I put it on there, but this discussion about a data framework, and this is addressing the first objective, where there's a sense that there's not enough data, and if there's data, it's not being shared properly, and it has all these other limitations to it. And so I think very framework minded, the way I think. Everything kind of has to fit in these boxes, and it has to make sense. It has to have some kind of flow to it. It has to have like the bigger picture, like you're saying. And so I've been thinking about this over the past couple of weeks to try and focus us into these chunks of work that we can do that are easier to manage. So for example, we've talked about, so far we've listened to different people talking about different types of data, different sources of data, different uses of data, and we have just barely scratched the surface. And I had a conversation with Lavner, and she pointed out something to me that I thought was really helpful, in that our job is not to solve this problem, but to kind of steer the agency in a direction to where they can work on trying to figure it out. And so if one of the things that we can come out with is some kind of framework that the agency can then use to kind of develop this bigger, robust understanding of what data sets they are, or where to look for data sets and how to look for data sets and potential uses of those data sets and who has those data sets. And so it started to get really confusing in my mind. And so I put together a framework. But before I ask Labna to put it up, I just want to say at a high level, again, our objective was to improve this data access and improve how the data is used. And also, I think most importantly is the experience with the data, because it's not really helpful to go in there and pick out like air quality data values, pollution data, but you don't know what to do with it, and it's frustrating. And so to create something that the experience it matches the person who is looking for the data, and it's interpreted in a way that they can use it. And so then the other thing is thinking about where are the chokeholds, where the problems are. I think the presentation we had listened to last time, she addressed some of those. What if it's a data set somebody has to pay for? Or a data set that requires like you to fill out some kind of order that needs to go through like, some kind of bureaucracy before you can get the data that you need. And so a part of what we're going to do is hopefully at the end of this conversation today or before our next conversation, start thinking about specific recommendations. So what I did is I applied what I call the logic model. It's something that's used in social impact assessments, where you start thinking about your inputs. What are you putting in? What resources are available? And, so in this case, we're trying to put data into this model, this logic model, so that we can have some kind of impact from the data. So we're putting in data. Some of the activities we're trying to do is obviously improve the accessibility. I did have slides, but I'm not going to share my slides since I didn't really clean them up the way I wanted to clean them out. So then you have the output, what are we offering? What are we looking for? Outcomes, what are the immediate benefits? For example, one of the things we'd be looking for is improved access to data by the community and relevant agencies. But for me, the biggest part is the impact. What is the social impact of our work today? I mean, granted, we're just talking about data, and data can be a really boring topic, but if that data can be used to support decisions that leads to a healthier community and healthier environment, I think the data plays a really, really important role. And so that is always constantly at the back of my mind. And while we've been asked to measure the outcome, I think I'd take it a step further and say, I would like to see us think about how we can start measuring also the impact. So you can put this next slide up, my little diagram up here. Let me kind of. Okay. Like I said, I am such a nerd when it comes to stuff like this. Any comments first on some of the things I just kind of mentioned about what we're trying to get to? I mean, the folks who are on the call, you know, please feel free to chime in via chat. And if Labna, you can flag if anybody says anything, let me know. Because I wanted this to be mostly us working through understanding the data questions. So what I did, again, is like I said, I thought through this as logically as I could. This is not anything final or anything, you know, this represents like a download from my brain. Okay, so there's a lot of things that are probably in the wrong area or things that could be moved around or things that could be enhanced. So I started thinking about the types of data out there. So we're on the logic model. We're thinking in terms of input. So what are we putting into this model to get a good outcome? There's environmental data out there. There's health data, there's socioeconomic data, and then there's community data. So those are the three main types of data that, four main types of data out there. If anybody can think of another, you know, another kind of bucket of data, just please, you know, let me know and we will add it onto this table. And the source of the data, again, this falls under that input of the data, comes from various agencies, different researchers out there, the regulated community, including the different industries. The data could also come from the community itself. It could come from social networking, the conversations that people have. People have used Twitter and other social apps to collate some kind of data that can be useful in understanding what's going on in a community. It can come from apps. There's some apps there that can collect air quality data and do all kinds of neat stuff. And so it was just thinking about all the different data sources. And then the third column talks a little bit how this, you know, what types of data that we're looking at. I summarized, I mean, I'm not going to go through all of it. You know, we know there's data that's used for permitting purposes, there's air monitoring data, there's survey data from the environmental side, and then health data. We have health surveillance data. The one that's missing on there is the health equity data that we heard about last time. I think, yeah, I saw that. is the patient's records, survey data, census data. So all that data can fit under that health bucket. And if there's anything, like I said, if there's anything missing, you know, this is an exercise that the agency can carry out and we can support them in carrying it out. The socioeconomic data is also very important when you're trying to support the EJ communities. And then finally, again, the data that comes out of the community. Okay, Sheila was looking very thoughtful over there for a moment, you know.
Yeah, I just wanted to say, I'm not sure what you mean by patient records. Are you talking about hospital data, or are you talking about, for instance, you know, death certificates, or all the above?
I think death certificates may fall under health surveillance data. I'm not really sure with the terminology that's used, but patient records, I mean like hospital records, the data that they use to find asthma exacerbation, like hospital visitation data, you know, that kind of data that's used to do like epidemiology studies, that's used to do, like in this specific example, I was thinking the data that's used to do health impact assessments and things like that.
Okay, I would just, yeah, that sounds good.
Now, I mean, if you have any recommendations in the language, you know, because that is your wheelhouse, that would be really, really helpful. You know, here you have a toxicologist / public health person trying to identified data sets. So it's like,
Yeah, I will give you more specific language
okay, appreciate
offline.
it. Okay, appreciate it. All right, Kelsey?
Saw the comment in the chat about changing the term citizen science to community data. I guess my comment was, and yes, definitely agree with that. But I was just wondering, how is community data a separate bucket, and why would it not just be within, what is the data that's being collected that's separate from health data, environmental data, and socioeconomic data? And why wouldn't the community data just be like the data source within these other buckets?
I pulled out community data because it's data that's generated by the community. And I think in ways it's been differentiated as that, I'm trying to think what they call it. The terminology escaped me. I can give an example of data collected by the Bucket Brigade. I don't know if you've ever heard of that organization that uses like a really simple way to collect air quality samples. And it's generally data that comes from the community. And there are concerns about the data quality or the limitations of that data. And it's something we should, I believe, address. There's a name for it. It's oh gosh, community participatory something. Somebody help me. My brain is shutting off on it.
Yeah, community participatory research.
Yeah, something like that. That's what I was thinking about. It's a little bit different. So health data is mostly collected by the agency and it's available on their website sometimes, but community data is sometimes difficult to find or difficult to access. It's some of the data that's collected by some of the community groups themselves. You know, like if they wanted to talk about traffic on a certain road and they collected their data and did it, that data would be separate from the data that came from the agency that does traffic data. So does that help, Kelsey?
Yeah, I mean, I guess I'm just thinking, like, if we're thinking of people collecting their own air data, you know, people have those purple air monitors at their houses. Would that not be a bucket within the environmental data? And then maybe in barriers to data access and use, you would say like, not sure, some data says you're not sure of the quality, because the community data is still environmental data or still health data and socioeconomic data. They're not necessarily collecting different data, they're just collecting it in a different way.
Okay. That's a good way of looking at it.
But that is just obviously just my perspective. That's my first thought. So obviously other people, if you have it, think differently, you leave it as it is.
Does anybody have any thoughts on that? I think I pulled it out because of again, because of the community perspective. I'm not even going to say that word right. I think I pulled that out because of the growing input that we're getting from communities with regards to data. And I think at the federal level, there are some programs around it to help enhance the robustness of those data sets. But you are right. It is environmental data. It is health data. It is, you know, socioeconomic data. It just has a different data source.
I'm trying not to really insert my opinion here, because this is really meant for a platform for the task force members. But I do agree with Kelsey in that it seems like a data source rather than like a data type. It you know, and like kind of as Kelsey mentioned, like you could flag community data as like ensuring that it goes through like a proper, you know, quality assurance, quality control, but it might not be a separate data type it to just like a different source that it's coming from. So I almost feel like community data should be listed under each of these data types as a data source.
Okay. Like I said, I appreciate the input. It's not written in stone, and I appreciate the input. Any other thoughts on the input side of this chart? Okay. And then I think the second level, what I was trying to think about was beyond just having this data, you know, what it is are we trying to do with that data? Like what kind of activities do we have on that data as you use the logic, when you go through the logic model? And there are many different uses of the data, potential uses of the data. And I just listed some, you know, just like I said, like my mind downloaded some of the data uses I had. And could anybody, you know, think of other things? I think as we develop our recommendations, we can, you know, list some of these, and if there are others, you know, that we can add to it and say, this is kind of our logical way of thinking of this, and these are some of the data that's out there, and this is how this data can be used. So, and this exercise could also go backwards, you know, like I was thinking in terms of a health impact assessment. I was thinking what kind of data would be required to do a health impact assessment, or if you're developing an environmental justice impact assessment, what kind of data would you need? And so just using this to populate the table. And then looking at, I separated out between how the agency would use the data and how the data would be used specifically, you know, by an environmental justice community or a DIC. I'm not sure if that's the best way to do it, but that's how I laid it out. I was trying to get at the barrier question. What are the barriers that people are having in accessing this data and using that data? So I left the column blank because I think the folks at the agency might be in a better position to fill that out. You know, I don't want to guess on your behalf. I started populating the environmental justice column based on the conversations that I've heard, you know, being a member of this task force, and, you know, and other conversations around, you know, environmental justice. And that list is by no means comprehensive. And I would really, you know, encourage us or the agency to help us populate that, or give us some, you know, some ideas on what some of the barriers are. We heard some last week. If there's anything else that we need to add on there, that would also be useful. I think missing from there is some of the things I mentioned. The cost of the data, you know, how many firewalls the data sits behind, you know, before you can get to it. Things like that are also barriers to accessing the data. So any thoughts on this so far? Oh, Kelsey, go ahead.
Yeah, I definitely think cost is definitely a barrier, probably for both agencies and communities. And another thing is the form that the data is collected in. A lot of times we run into data that's like given to us in PDF format, and we have to spend a really long time manually extracting it into a more usable format. Another thing is a lot of times the variables that are collected are not what we're looking for. A lot of times we need like, you know, specific location data like lat long, and that's not available for a lot of data. And so, yeah, I think those are and then also the fact that different data sets are owned by different people. So if you're trying to find a central place to answer this one question. You have to go to like 12 different websites to find 12 different data sources owned by 12 different people, all in different formats. So I guess that those are my main things: cost, ease of or location, access, format of the data, and the variables that are included.
That's helpful. Does anybody else want to weigh in about what they think some of the barriers are?
Just a clarifying question, I guess, for Kelsey, the cost, location, and format, do you feel that those are barriers for all different types of data for the agency?
Yeah, I would say so. I mean, in cost, I mean, in some cases, of course, we're collecting the data, so then it doesn't cost us anything to get it. But sometimes some data sources you have to purchase. I mean, that's probably, cost is probably more of a barrier for community members than for the agency, but we have run into that before.
And Kelsey, if it's okay, I might add, I think cost is a barrier, not so much in terms of data access often for us as the government, but in data use. So, when we have agencies here, right? But just taking CDPHE itself, we have 8 or 9 different divisions across the environmental and public health side. Each of those agencies has many different, often databases and data sets and ways of collecting data that don't always speak to one another, and there's no sort of easy way to connect all of those. And the cost of actually developing sort of effective ways of sharing that data even within an agency, and then of course between agencies, right, between different state government agencies and between federal government and local governments and tribal governments. I think that there are definitely cost constraints there that are not so much accessing the data, but sort of updating our own databases to use the data more effectively between different branches of an agency or among agencies.
So I guess kind of follow up with that.
Sorry, Uni, I'll let you finish your thought, and then Juan has his hand raised as well.
Oh, okay, let me go. Yeah, let me just follow up with this real quick, Juan, and I'll get to you. So within Colorado's agencies, you don't have like a central agency that manages data. Let me just put it out there. So everybody's kind of has their database in Access, and somebody else uses Python or something, or so there's no centralized US digital services, like in DC, the federal government has a central agency that does that. So okay.
Yes, Uni, that's correct.
Okay. That answers my question. Go ahead, Juan.
Yeah, I was going to comment on the really kind of echo what Kelsey was saying. And so I'm with Green Latinos, I'm the Clean Transportation and Energy Policy Advocate. Prior to that, I was with CDPHE in the Health Facilities and EMS Division. And I come with a background, a master's in public health, environmental health science and policy. And I would say for community, so from the Green Latinos perspective, barriers to data access is definitely the cost. So if I'm looking at research data on air contaminants and how that's impacting communities, and I find a source, then I've got to go, and because I have still academic access, I can access a lot of resources. But if prior to me coming on, Green Latinos did not have somebody with that academic access. So they were having to purchase, right? So that cost to access the data, and then the data in different formats, as others have mentioned, right? So if it's in Access or if it's in PDF or if it's in Word format. So then I'm having to get an Excel server account. I'm having to get an account with other bodies that are collecting the data. So then that becomes a cost barrier. And then if I'm working with community in Commerce City and they're trying to access that data, if they're aware the data is out there, they're also looking at that cost. And maybe Green Latinos can afford the cost, but the community grassroots group certainly does not have that access either.
Yeah, that's extremely helpful information. Those journals can cost almost $45 per journal if you don't have access to it. So thank you. And thank you for joining us. I hope you can be dialing into some of our calls because you provide a really helpful perspective. Thank you. Okay, I think Sheila had her hand up first.
Yeah, so the CDC is certainly recognized their deficiencies around data. The pandemic has exposed them. And so there's this data modernization, visualization initiative, and part of it is creating data linkages between data sets. And so I'm wondering if it would make sense to tap into that work, because I think it would be very helpful for Colorado state agencies, but certainly for this work as well.
I shared a link. I'm not sure if that's a part of the effort of what the CDC is doing. It was embedded into the agenda. I don't know if Lubner, is she still there? Is it something you can? Is that what it is? Okay, yeah, I thought, I mean, if you have time, just cruise through that website. It has, it's very, very, well, I think it's very well done. It covers a lot of the high level areas that might be interesting to community members, but it doesn't do the deeper dive that would be more specific to your location, your specific location. Like, for example, I think the smallest unit they may have in there might be a county level data. I can't really remember when I was cruising through it. So I think Joel shared the link. Beatrice, go ahead.
Yes, it's the smallest, it's the county.
Yeah.
But nevertheless, I'm just wondering, and so you're thinking more census tract, or what are you thinking scale wise?
I'm not sure. This is where I guess the community can really give us guidance at what granular level that they would need to create the cases they need to make. So I think EJ screen goes down to the census tract. I think, Joel, are you on here? Can you?
You need that. That's correct. I'm 90% sure EJ screen goes down to the census tract, though I just realized I'm not 100% familiar with the recent updates that EPA made to it. In Colorado EnviroScreen, we are going down to the census block group level, which is the most granular we were able to get data for our state level tool, so that census block groups are smaller than census tracts. And we weren't always able to get data at that level. So at times we have some indicators that are at the census tract level that are sort of aggregated for all the census block groups, and one or two indicators that are county level, especially for health outcomes, where we don't want to accidentally violate HIPAA by reporting health data at too granular of a level, right? For certain types of cancers and stuff that can be a risk. But for the most part, we were able to get data down to the census block group level in EnviroScreen, and so that's our most granular level of indicator. And I should mention that I believe Kelsey, who's with us today, and then Margaret and many other members of the Toxicology and Environmental Epidemiology Office who are working on EnviroScreen, they are actually funded through the CDC tracking program that we're talking about. So Colorado is a participant in that tracking program. We do report data there.
May I just add one more thing? From what I understand, my understanding is that CDC wants to go beyond, so that they're linking, you know, environmental data to infectious disease data to, you know, that there's going to be these linkages that are created. And I think, and I don't have details, but it would be interesting to sort of see where they're going with all this.
I think it gets a little bit tricky because you're not really talking about causality there. You're just talking about, you know, putting data, you know, that's why I think that, you know, the conversation about risk communication, I think is also plays a really important part in this. So, because people, you know, what are you seeing? What does this data really mean when you look at it that way? But I think the reason I wanted that link shared was because it may serve as a really good starting point when we start thinking about a central access to data for people to use. And then the other question that I think I would pose out there is, what is helpful to the community? You know, a census tract or a census block, does that really get at the exposures that people are concerned about? If it's, you know, an environmental concern, does the data get to it? So like EPA sometimes talks about fence line, and identifying a fence line community is maybe parts of certain census blocks. So that I'm just following my thoughts here, by the way. So just step in when you can. So Beatrice, go ahead before I get carried away with my thought.
Yeah, I think it would be really important to also figure out how we can incorporate county and city level data, even for some simple stuff that we might not think about as environmental justice, like sidewalks or simple infrastructure like that, that does really impact water runoff, right? And curbs and streets into people's patios. So some of that information is you have to buy it, and then it's by city. So I feel like sometimes cities aren't talking to like the broader information. And then the other thing too that I think could be really powerful, and maybe I'm aiming too high, but it would be great that as you're looking at the data sets, you understand the jurisdiction you're in terms of maybe your utility, maybe who is on, you know, your water quality, who is your representative, in which county are you, or is it is your water being provided by the city? Is it on a private well? Is it the county? Like, all this information is so hard for people just to understand. And I would love if we could maybe even identify, you know, because we have regions, right? The EPA region 8, right? If we can go to a federal to state level to, and then that way people have a better picture of who kind of are the agencies that you can maybe enhance change in your community. And if that could be part of, if it's like a map, right? Then you can also go to the different agencies or contacts for your specific concerns. So you can start having the tools and the power to address some of those issues on your own as well. And again, it's so convoluted and so complicated that it would be great to be able to have that information as well. Kind of going back to Shayla, not just going on the, you know, deficiencies, but where are the assets, and who should I contact, and where can I report anything that my community is experiencing.
Thank you. I'm beginning to see this recommendation is going to be a mini booklet at this rate, just because of the interactions between all the different variables in this, you know. Go ahead, Kelsey. I saw your hand up.
I just wanted to say that that's a really great point that Beatrice just brought up. We have like a call-in number for environmental health concerns, and we often get calls that are really just people needing to know the correct contact of who to voice their concern to. So I think that's a really great point that was brought up about like who at this office can I contact about this concern about air pollution, or this concern about hazardous waste, or whatever their concern is. It's sometimes just the first most difficult thing is determining who I can contact to voice this problem.
Question, Kelsey. Do you do a report on like the various buckets of calls that you get? I think that would be interesting for us to learn a little bit more about. Like, is it like specific complaints, or is it, I think it would be helpful if we could get like a summary or something, if you guys do something like that.
We have a tracker, so we track all the calls that we get and like what was their main concern. Was it lead? Was it PFAS? Was it, you know, what all, we have some main ones, and then there's a, you know, a fill-in for other things. So yeah, we do track it all. And I think, I'm not sure how long we've been tracking it, but we could probably, it would probably be not too much time to put together a little summary, like we got this many calls about lead, and we got this many calls about this many calls, people just needing a new, a better contact. So I can talk to Christy about that and see if that's something we could do, if that's of interest.
Oh yeah, I mean, it's definitely of interest, because one of the challenges that I'm seeing that we're running into is just in terms of, I don't use the word variables, maybe indicators. You know, what are the things that are of concern to people? I think that's a place to start. I think if we focus on something that's doable and manageable, and get some results on something like that, it'd be much easier than, you know, then kind of putting it out there and we're trying to wrap our arms around this, like this really, really big problem. So if that data could be useful, then it gives you a sense of what information people are looking for. And then we make sure that we can test it as a case and make sure they have access to it. So when in terms of when we want to measuring success. So this is a part of that conversation on impact, you know, that call-in center could be a really good measure of an outcome. Now, do you see a decrease in the numbers about this because we managed to put this out there? So. Okay, any other thoughts? Yeah. Go ahead, Kelsey, sorry.
I was just gonna say, yeah, for sure. I'll talk with Christy about it and see if we can put together just a summary of what the most common concerns.
Okay.
And can I just add something too? I think in the language of the Environmental Justice Act, there's part of it was like kind of quantifying or mapping. I don't know exactly how we would do this, Joel, of who reaps the benefits and who is suffering the consequences of environmental injustice. So I'm always trying to go back to that part of the language in the law about how we quantify who benefits and who carries the burden, and how to make that visual or understand, and then how do we collect data too about, you know, who is reaping the benefits. May it be via investments, dollars, the difference of health outcomes. I don't know exactly how to do that, but again, that part of the language is always like in the bill, always I'm thinking, I was like, oh, I have no idea how to illustrate this as well. You know, who reaps the benefits as well.
Yeah, that's a great question, Beatriz. I think that language is in the legislative declaration part of the bill, which is interesting because that really creates like the the framework and the idea and the purpose and the motivation for our work to implement the EJ Act, but isn't necessarily, it's not like a specific, you must do this by when requirement, if that makes sense. But I think as we've discussed, and I'm losing track of subcommittees, at least one previous subcommittee, Professor Katie Dickinson and her graduate students at the Colorado School of Public Health Anschutz are going to work on a project kind of trying to understand the relationship between who benefits from activities that result in environmental health risks compared to who sort of bears the burden. And I know that they're working on that project and plan to turn it over to you all as the task force. So I don't know if that's sort of responsive to what you're thinking of, Beatriz, but Lubna, would you be able to fill in a little more detail there? Lubna is really the main point of contact for that project.
Yeah, that's correct. I mean, and that was what I highlighted at the last meeting, that this group of students is going to be focused on that, because I've heard you mention that multiple times at these meetings, Beatriz. It's definitely not unnoticed. So yeah, we're working with them to see if we can kind of come up with a benefits versus burdens map and see kind of what that looks like.
Okay. Any other comments?
If it's okay as a non-task force member to just quickly weigh in again, I think a lot of sort of the data tracking for that Kelsey is talking about and sort of understanding the types of inquiries or complaints or concerns or just questions that come into the agency, especially for disproportionately impacted communities, that sort of improving those systems and streamlining them both in terms of the responsiveness and our actual complaint process and data tracking. That's very much what the Environmental Justice Act charges the Environmental Justice Ombudsperson, Marcus Howell, to do. So Marcus just joined CDPHE, I meant to say earlier this month, but it's now April. So last month, and he is starting to work on those systems and processes. And I think if this subcommittee has recommendations for how he can kind of effectively establish those processes or the types of data he should be tracking, I'm sure Marcus would be open to hearing it, and he can either come to a future meeting or we can give him the recording of this one. But that's certainly something that we can keep in mind as you all shape your recommendations.
Thank you. Any other comments on this? I feel like I had everything formatted in my brain in a nice framework, but now with this conversation, I know now it's like I have to go revisit it and potentially add in some more columns or maybe some more information in there. Bye, Beatrice. Thank you so much for joining us. We'll talk to you in the next round. Bye. Yeah, so now we're down to only one other member, so I'm not sure whether we should continue this conversation. I'm not sure what our quorum is. Our rules, we never really talked about that.
Yeah, because I have to jump off in 15 minutes. So I'm kind of wondering if we should just have a follow-up meeting.
To finish off the rest of this.
Yeah.
I would second that, because I think I've heard this conversation has been really good. I've taken a lot of notes, and we can most definitely go back and revisit this little framework and maybe move things around and enhance it a little bit more, and then will give me time to tee it up for the next conversation on how do we improve research and data collection. So I support calling, breaking early.
Okay, yeah, that definitely works. Uni, I wasn't sure if while you and Sheila are both on the phone, if you wanted to talk about objective 2 at all, or if you wanted to, table that and we can reserve that for another day.
I think I want to table it. That's what I was getting at,
Okay.
because we have a lot of the input that I heard today, will kind of influence now how that framework looks like. And if it's going to serve as a point to set conversation on objective 2, then I think it needs just to be in a different space. So I can take the time to work on it. Yeah.
Okay. Yeah, that makes sense. So why don't we, and I guess, Sheila, for you, I wonder if we might want to shift to like 1-hour meetings instead. Do the 2-hour blocks, is that not doable for folks' schedules?
It certainly isn't doable this month and May. Yeah.
Okay. And Sheila, is your calendar up to date? Like, is that?
It's not, because Alex, departed in mid-March, and Ace is helping somewhat, but we don't have the admin support. So my calendar is much more full than what appears, because I just don't, Alex hasn't been, he used to fill it up, and now I'm having to, and I have work to do too. So
Yeah.
yeah.
I was starting to gather that just given how busy you are. So I do want to find a time that like works for you and Beatriz and Uni. Like I said, this is a much smaller subcommittee, but because of that, I feel like we can have a lot more of like the in-depth and like nuanced conversations. And I just want to be able to make sure that like the 3 of you can meaningfully participate with each other and have the space for that. So maybe what I'll do, Uni, is I'll work with you to schedule another meeting in May. I know, Sheila, you said that your May is pretty busy, but maybe I can just check in with you before we kind of officially send out the calendar invitation. Hopefully like a 1-hour meeting will still be more doable. And then I can just cross-check with you to make sure that the time works. Does that sound good?
That sounds great.
Right. And I just want to take a real quick second to acknowledge JD's comment. And odor is most definitely, one of the indicators we're thinking about, and also how it impacts, the quality of life, which is general sense of talking about mental health. So I'm just thinking in terms of what data is out there, who has that data. So we're kind of going through all this as systematically as possible so we can capture, all the data that's out there. I know Sheila has to drop off, and I think, okay, I will allow, if it's okay with the folks at CDGT, allow, JD a moment to speak. Since he has.
I just wanted, I appreciate you letting me do this, Tangas. From the heart. But I want you all to understand, you are the enemy, and when you look at your history, when you look at the way things are done here, you have to come from that perspective, because there's not a lot of faith in this department at all. And look at your own history, okay? And I think if you keep that in mind, you'll find out that you might get a little bit further. And that comes from a good place.
Okay, I appreciate it. And I think there are very many lessons to be learned in this day and time. And hopefully, we learn from our mistakes and move forward. And thank you for being a part of the conversation. The input that you have provided on the different calls gives us a pause to think about ways that we can better serve.
And just understand, the reason I left the other day is that's in protest, because I'm telling you, the CDPHE, there's some very, very bad internal problems that you guys have really got to face. I'm very disappointed in a lot of different ways. This is our last chance. I'm lying. So I do sometimes get upset, and when I leave, I'm in protest. En un buen día, Tangas. Un otro día.
Again, we appreciate the input. All right, we will reconvene and when Lobna does the magic that she does to get all of us together. So everybody have a good rest of the day and weekend, and we'll convene next week for the task force meeting, I think.
Yeah, we'll be meeting with the full task force on the 19th. And we have another subcommittee meeting next week on best practices for community engagement on April 12th. That meeting will be from 4:30 to 7. That's the one that Ilda Nusete chairs. So hopefully we'll see some folks then, and if not, at the full task force meeting on April 19th, which starts at noon. So,
Okay.
and then Uni, maybe you could hang back just for a couple minutes and we can kind of talk next steps, if that's okay.
That's fine.
Great, thanks a lot.